looking at the statistics and the numbers, and flu cases look like they're almost non-existent. There are some, but nowhere near years past. What's your take on this? Why is that?
So if there's any bright spot this winter with all the pandemic, it's that we really aren't seeing flu this year. To put it in perspective, I'll say this. Last year at this time, we had about 150,000 people in America that were hospitalized with flu. This year at this time, we have about 150. So you can't even compare. It's so much less this year as it was in the past.
Wow. So is it, why is that? Because is it because masks, social distancing?
Absolutely. So the things that prevent the spread of COVID also prevent the spread of flu. And so it's the masking, so social distancing, not gathering in groups, washing hands. Those things that preventing the spread of COVID also prevent the spread of flu. And on top of that, we have a vaccine for the flu that a lot of people already received in the fall and early winter. So you really have both things. And honestly, that gives you hope with COVID. Once we have both things for COVID, that we'll see kind of that same dramatic drop.
And some people argue, and I've been asked this before, well, if you wear the mask, my mask right here, if you have the mask and it's stopping the flu, why isn't it stopping COVID spread? But I'm assuming there's many factors at play here.
There's a lot of factors at play. Part of it too is the amount of COVID in the community was already at a higher level going into the kind of this flu season, where the amount of flu was already very small. And so that's part of the reason why we haven't seen as much spread. I also think what we see with COVID is most of the time people get infected, they're infected by somebody who doesn't know they have the illness. Where with flu, oftentimes you're contagious more with symptoms. And I think in the past, people would be hesitant to go, well, if you had a little sniffle or a little cough, you may still go to work and then you may spread it there. Now with COVID though, people are a lot more careful. And so I think as far as like flu going and spreading, I'm hopeful that moving forward, flu will spread a little bit less easily because people are less likely to go to work when they feel a little ill.
Now, I know everyone wants it to be the day where they can go to a Tigers or Lions game and not have to wear a mask or not go out. Some fear that, oh, we're going to have to do this for the rest of our lives. What do you you probably meet people and say that sort of thing. What do you say about the fear that this might be the new norm forever?
So it's a good question, because you say, man, we all wore masks and got our flu shots and we really didn't have flu happen this year. So if we just did that every winter, we wouldn't have flu. I can't fathom, being a human being, I can't fathom wearing a mask every winter. I just can't. Life is full of risk. And at this point, with COVID being as deadly as it is, the risk is great enough that we need to do all the things that we've been doing. Gotcha. I suspect by next winter, the masking requirements will probably start to decrease at some point as more and more people are vaccinated against COVID.
Next winter.
Yeah, I don't have a crystal ball to know when we're going to be able to stop wearing masks. My personal hope is that this summer it's a little bit less as we're outdoors anyway. But as far as wearing masks indoors, we'll have to see what happens.
Well, does this change the way they look at illness and disease? Like you said, the flu from now on, if someone has a really bad sniffles, in the past, I would be like, oh, rough it out and go to work. But in the future now, maybe you're thinking, oh, I'm not going to. And by doing that, that will limit flu, coronavirus, other cases.
That's exactly right. And that's exactly what we'd hope to see is, I think going forward, when people go to work, I think that their boss is going to be hopefully a little more lenient about saying, hey, if you're feeling sick at all, don't come in. And now that we've gotten so much better with virtual too, I think it's okay if you have kind of a mild illness that could be contagious to others, to be able to stay home and work virtually. So I think we'll see a little bit of a shift in how people work and how people respond to when they're mildly ill. Gotcha.
Okay. So the flu, it's never going to be gone. It's here. Yeah. But it's just like, now, is COVID in the same family as flu? I mean, similar?
No, they're two different viruses.
Okay. Is it going to be maybe end up like, once the vaccinations come out, as, I don't want to say as commonly treated as the flu, but like flu cases? I mean, we're not going to see as many. There'll be vaccinations. It'll be kind of treated like the flu as.
That's what a lot of experts are guessing, kind of along those lines.
Yeah.
To be honest, coronavirus itself is already circulating around the world, and it has every winter. A common cold, a very common cold, is coronavirus. There's others, rhinovirus, et cetera, adenovirus, that cause similar symptoms. But we've all been affected with coronavirus multiple times. This one's different enough that it's causing all the havoc that it is.
COVID-19, that's why it's COVID-19.
Yeah.
Yeah, okay. So advice to everyone, just keep on, I don't know, what is your advice just to everyone who's watching?
So while it's absolutely wonderful that we're not seeing flu right now, we're also relatively early in what a typical flu season is. We really don't come out of it until the weather starts to warm up closer to April or so. And so it's important that we keep doing what we're currently doing. Hospitals are busy. The fact that we haven't had a lot of flu patients has been a relief for us. The fact that people are social distancing and wearing masks and got their flu shots has made a real impact on our ability to care for patients this winter.
Yeah,
and so it's important that we just keep doing that.
I didn't even think of that, but if you had to deal with all the flu cases on top of COVID at the hospitals, you would be very busy, and even on top of everything that you're already dealing with.
Yeah, so we are so grateful again that we're not seeing a strong flu season. Really not seeing any flu season right now. And again, that could change. We could see an uptick in particular if people stop doing the things that are preventing COVID. COVID will spread, but flu could also spread.
And the people who say, oh, it's just being misdiagnosed and being called COVID.
Well, what's interesting on the flu, I can tell you, we frequently are testing for flu when we admit people at the same time that we are testing for COVID. Oftentimes we can test those together. And in fact, looking at the United States, we've tested about 800,000 people, or almost 1 million people have been tested for flu since this started. And so far, roughly 1 or 2 out of every 1,000 tests we do are coming back positive for flu.